Guys, look at this MCQ. What is the treatment of choice for Mr. Duraiswamy who presented with focal seizures? So he's having focal seizures. And when you do a CT scan, it shows a solitary lesion with eccentric nidus of calcification. Okay, just a solitary lesion is there. And there is a nidus of calcification. And his intracranial pressure is normal. So what is the treatment? First of all, let's make a diagnosis. Focal seizures, and they're saying there's a solitary lesion. So it could either be a neurocysticercosis or a tuberculoma, right? So what and all can it be? It can be a neurocysticercosis or a tuberculoma. Okay, so neurocysticercosis means because of parasitic worm, and tuberculosis will be tubercular bacteria causing it, right? So the main difference you have to know here is in the tuberculoma, this person will be unwell because he has tuberculoma, right? Tubercular, so he will be unwell. But in this neurocysticercosis, systemically he'll be fine. Okay. So in this they have not mentioned anything. They have just said there are seizures, right? Another thing that you have to note here is that the intracranial pressure is normal. Okay. So it is a solitary granuloma. So definitely it is a intracranial pressure is normal. But in tuberculoma, it can be raised only. Okay. So here we will go with neurocysticercosis, guys. So it is caused by what? Worms, right? So you have parasitic worm here. So basically, will you give anti-tuberculous chemotherapy? No. So this is not the answer. Now here, will you give steroids alone? No. So it should be something between C and D where you are giving anticonvulsants because this guy has seizures, and do you want to kill the cysts? So cysticidal do you want to give? So now that is where you have to say. You see, if it is simple neurocysticercosis, then if you just give anticonvulsants, it's enough. Okay. But if it is complicated neurocysticercosis, if there are multiple lesions, okay, then or if there is intracranial tension, if there, okay, that is intracranial pressure is increased, only then you will have to think about as complicated neurocysticercosis. Here it is more like a simple neurocysticercosis to me. So according to the textbook, I am going with this anticonvulsants for 2 years. Okay.